In today's environment, where a vast amount of information is available at your fingertips, finding credible information online can be a matter of life and death. Health-related websites, government resources, social media, and group forums can make it seem almost impossible to know who to trust. Searching for more information on symptoms, diagnosis, and treatment options can be difficult, but there are steps you can take to make the process easier. For example, it is important to know who operates a website and what their agenda really is. Does the author include references to the health information? Do other websites and sources concur with that information? Is the information up to date? Does the site sell a product or service? And how does that affect their articles and research? Are they trying to cause fear or anxiety to coerce you into purchasing a product? Look for the site's terms and conditions and privacy policy. Legitimate sites will have both of these in place. Finding answers to all these questions will bring you one step closer to accurately gauging a website's credibility. When researching a particular topic, you may come across a wide variety of scientific papers, journals, and studies. So, how can you tell when an academic paper or health study is credible? Here are some questions you can ask yourself to assess whether or not you should trust a source. First, is the information up to date? Primary resources, such as academic articles and papers, should be published within the last 10 years. Secondary resources, such as newspapers and magazines, should be published within the last 3 years. Who is the author, and what are their credentials? Information should be written by a health professional or an expert in the field. Check the author's background for anything that could potentially strengthen or weaken their credibility. Is the information accurate, or does it conflict with information found in other reputable sources? Are there any conflicts of interest? What organization is behind the research? Who is the publisher? Who is funding the project? And is the research being pursued for financial gain? Is the information from the sources accurately represented? If it is an academic paper or article, is it peer-reviewed? In other words, was it evaluated and approved by other experts in the field? Can you find rebuttals or counter-arguments to the study? Is there an agenda behind the information being provided? Remember, malevolent players exist in any industry, and healthcare is no exception. There's good science, and there's bad science. Academic health papers often contain the most up-to-date findings on health conditions and treatments. They can be a very useful tool for patients seeking information about the best, modern treatments. Here's how an academic paper is typically formatted. The abstract is a summary of the paper's research and its findings. It is found at the beginning. The introduction is where the researcher or researchers will state the intended purpose of their study. It contains background information of the topic and any previous relevant studies or findings. The methods and materials sections describes how the study was conducted and the research methodologies used. The results section details the outcomes of the study. This section normally shows data collected throughout the study in graphs, tables, and charts. Researchers explain the findings or discoveries in the discussion section. Generally, this is also where strengths, weaknesses, and ideas for future studies are included. The final component of the paper is the acknowledgement section, which includes information regarding contributors to the research, such as individuals who worked on the study or provided the funding to make the study possible. References to sources are also included here. The types of studies that researchers can choose to base their papers around can also be as complex and varied as the papers themselves. Knowing what type of study you're looking at is a valuable skill to have. Studies typically fall under two categories: observational and experimental. Observational studies usually focus on collecting descriptive information, and are used when researchers are trying to observe a phenomenon without intervening. These studies cannot determine causal relationships, nor can they explain what exactly is causing a particular circumstance. They can only determine if there is a correlation or association between two factors. Experimental studies involve some type of intervention when done by the researchers. For example, this could take the form of introducing people to a varying dosage of a new drug and observing the effects, or having people change their normal lifestyle habits for assigned periods of time. Unlike observational studies, where the goal is to gain descriptive knowledge, experimental studies seek to explain why a particular phenomenon occurs. Because of this, these studies can be used to determine causal relationships. Despite your best intentions, it's not always possible to access or understand scientific research. You should always be skeptical of any health or medical advice. If you have doubts about a particular product or treatment, don't be afraid to trust your instinct. Your instinct is a deeply grounded knowledge base developed from your own personal and prior experiences. Choosing treatments, procedures, and what goes into your body is your right and should never be coerced.